So there are four conditions in which the patients can experience shoulder problems. The first one is a frozen shoulder, in which they have difficulty lifting their arm up and rotating it out. There can be pain as well as stiffness of the shoulder. This can cause difficulties in activities of daily living, like combing your hair, clothing, and in extreme cases, there might be difficulty in sleeping also. In the second category, there can be pain but no restriction of movement when they are trying to lift their shoulder up. That is because the rotator cuff gets pinched in between the bones of the shoulder. This can cause pain in the nights, pain while lifting their arm up, and while internal rotating. For example, when you're trying to tuck your shirt in on your back or reaching for your back to pull out your wallet. The third condition is rotator cuff tears, in which there is not only pain but also weakness. In extreme cases, the patients might not be able to lift their hand at all because the muscles which are responsible for moving the shoulder, they might be damaged. And the fourth category is dislocations. The shoulder can become unstable and loses its stability. That means once a shoulder dislocates, it keeps popping back out again and again. It can happen after any specific activity, or sometimes in extreme cases, it might happen in the sleep also. It's fairly easy to spot it. The shoulder feels out of place. It is extremely painful, and then after a little bit of wiggling around, it might go back in, but you might have to go to the hospital to get it pulled back in again. So these are the common conditions which I see in the shoulder. The initial symptoms of all of these is usually pain. Pain might be niggling to start with, but it steadily increases. The second important problem with the shoulder is lack of mobility. You might lose a little bit of movement. You might not be able to lift it up fully or rotate it outside or turn it back inside. So loss of mobility is the second thing. And the third thing is lack of stability. That means your shoulder might start clicking, it might start clunking, and it might obviously dislocate. So it's always recommended to take professional help early. Don't neglect these things. If it is not subsiding within a few days or a few weeks, then you have to consult a specialist.